Hi everyone, I'm Dr. Sarah Bradley Cook, and I will be your professor for biomedical statistics. A little bit about myself. I am trained as a biostatistician and epidemiologist, working primarily in clinical settings. I'm a clinical epidemiologist in terms of my career, for most of my career, and I've returned to teaching after previously being a professor at Mercyhurst University in Pennsylvania. So I have taught statistics to nursing students. I've taught statistics to future physician assistants. I've also taught statistics to doctors or even surgical residents. So I enjoy teaching statistics to a clinical audience, and I'm going to try my best to make it as relevant as possible to your training, whether it's in nursing or in public health or anything really in the health sciences. But that's my background, and I really find statistics to be a really powerful tool within healthcare. And we really do rely on biostatistics and research to know what we're doing is actually effective. So we'll talk a little bit about how statistics relates to evidence-based practice. But just today, I want to ease into biostatistics because I know that it's not everyone's favorite course, at least at first, until you get hooked on it like me. I was actually a sociology major as an undergrad, and I was forced to take a statistics course, and it kind of changed my life, I guess. But it was the realization that I could apply statistics and research methodology to address real problems that were important to me at the time, health-related issues that facing society and facing our population, including the HIV/AIDS epidemic. And so before I knew it, I decided to continue my training in biostatistics and epidemiology. I'm guessing that's not the route that most of you will take, but I'm going to try to instill a certain amount of passion for data analytics and research, even if you aren't heading that direction. And I also want to emphasize that we all need to be literate in statistical methods, primarily so that we can critically evaluate the scientific literature, especially as it relates to medicine and medical practice. So it'll make you better nurses, it'll make you better physicians, it'll make you better able to understand even personal health information that comes out from research. So that's a little bit of background. I hope to get to know all of you over the course of the next few weeks. Today, we're going to talk mostly about the major themes in the course, and also just an overview of some of the structure of the course in terms of what's available to you online, and also the expectations and the deliverables for the course. So today we're going to address several topics, including what is biomedical statistics. I'm sure when you told your friends you were taking biomedical statistics, they went, oh boy, what's that? We often also call it biostatistics. Biomedical statistics is a little more broad in terms of the application of statistics to medicine, but really it's the same thing as biostatistics if you've heard of that. And really it's an applied form of statistics. We're applying statistics in the realm of medicine, mostly in the context of research, but also in terms of just our day-to-day work in assessing the values that we encounter throughout our day, statistical information, lab values, those kinds of things. And I think the statistical approach and understanding will open your eyes to some of the things that you do routinely, and you may not even know why you do them. And there's often a statistical or at least evidence-based reason for why you do what you do. In this course, we'll also talk about frequency distributions, which is an important way to visualize our data, to understand the distribution in terms of the most common values that we are likely to encounter in, let's say, medical settings or within a population, And that's just a very powerful descriptive tool. And we'll do other descriptive techniques in this course. We'll also discuss levels of measurement. Measurement is kind of the forgotten part of research. It's really crucial that our measures are good measures, whether it's something simple like blood pressure or something that's more complex and requires more nuanced approaches to measurement. The more we can measure things validly and reliably, which we will not get into depth in this course on, the better our statistical analysis will be and the results can be more trustworthy. One expression that you'll hear is garbage in, garbage out with respect to research, and that's true. So measurement is an important piece. But in this context, we're going to mostly talk about the levels of measurement that exist and how we apply appropriate statistical tools to that measurement. We're not really going to assess the quality of that information, but we are going to do our best to try to apply the most appropriate tool. We'll also discuss measures of central tendency, which you may know as the mean, the median, or the mode. And you've probably encountered these throughout your lives, just averages, but they're really important concepts for not only understanding a population in terms of their characteristics, but also to compare to populations. So for example, if we're implementing a new treatment regimen and the mean score in one group is different than another group, that might be some evidence of difference that we can attribute to some sort of intervention. And so just comparison of two means is a very powerful tool that's used throughout research. We will get into what we call bivariate analysis, which is simply looking at two variables and their relationship, and there's lots of approaches to this that we'll learn, and the different tool that we use really depends on what the level of measurement was. So though we'll learn 5 or 6 different techniques for doing bivariate analysis, the reason we choose those tools is so that we can apply the appropriate tool to the job. We'll wrap up the course with an introduction to correlation and regression. You will get introduced to the concepts of correlation earlier in the course, but in the final week, we will really focus more on what correlation is useful for and how to assess whether our data is amenable to using correlation and regression and to interpret the results from correlation and regression. And that's about as far as we're going to get, and that's about as far as we need to get for an undergraduate statistics course. And once you start to think like a statistician, or you think in terms of the way that research is done, it's really going to make you a better practitioner. And that's the hope here, in addition to giving you some skills which are widely in demand outside of healthcare, especially in areas, emerging areas like data science, and within industry, there's a lot of demand for statisticians. I never worry about having a job being a statistician, although I try to apply my skills to the good as opposed to evil purposes. And so that's one reason I'm passionate about teaching undergrads, is that I hope that we can use these tools for mostly beneficial purposes and to make really good decisions in healthcare. So I mentioned that biomedical statistics is an applied statistical analysis. This is not a math class. If it were, I wouldn't be teaching it because I am honestly not that great at math. I'm okay. I do fine, but I'm not interested in the mathematical portions of statistics. It doesn't excite me. And I'm guessing for most of you, that's not a motivating factor in you taking this course. However, the emphasis on applied is that a lot of the data that we're using in this course and that you'll see in your textbook is based on real world data and things that are questions that you may actually have in the course of your career, or similar questions that you may have. And so by applied, I hope that also means that it'll be more interesting to you than something that's pure statistical theory. So we won't get a lot into those types of topics. We do need to talk about probability theory and some of the history, a little bit of statistics to get to where we need to get to as far as our understanding, but we're not going to go much deeper than that. And so there is no expectation that you had a recent math course or that you attained any specific level of math training. So you can breathe. And it's used in medical research and what we call now evidence-based practice within the nursing area, but it's widely used beyond. The same techniques are used in other disciplines, but biomedical really refers to the fact that we're tending to study biological or health-related phenomena. But the tools that we use are also used in business. They're used in all kinds of applications. And so the major focus is on human health, medicine, and biology. And I'm going to do my best to make sure that the examples that we have in this class are ones that will be at least somewhat in your world. So we're not going to look at business problems or other types of problems that you may have encountered in other statistics courses if you've taken them, or math courses in the past. So really it is directly applicable to your other training. So biomedical statistics is really complementary to other parts of the research enterprise. So my doctorate degree is in both biostatistics and epidemiology. And epidemiology, which is in the news a lot these days, thanks to COVID, it was a term that I hadn't really heard when I was an undergrad a long time ago. But the study designs that we use in epidemiology, case control studies, cohort studies, cross-sectional studies, randomized clinical trials, to name the main ones, really biostatistics and biomedical statistics are often used in conjunction with a specific study design. The ones that we're going to learn today and throughout this course are ones that really are used across these different study designs, but we're not going to go into depth where you could actually perform necessarily a complete study, although you could do, in theory, enough analysis to do a randomized clinical trial. And we'll talk about why that is such an important study design a little bit. We also use statistics to estimate population level rates of disease burden, risk of disease, treatment efficacy. So when you hear statistics about the percent that we need to be vaccinated in the population or other kind of statistical information, there's behind those claims or behind those assertions are data-driven evidence. And we apply statistics to say what will happen at the population level based on taking samples from the community. We don't have the full picture of what's happening necessarily, although in the case of vaccination rates, I'm not sure how much of it is estimated and how much of it is pure counts and represents the entire population. But in either case, we use statistics to understand what's happening around us every day. And so sometimes we just want to get a really good grasp on what's happening, how many people are currently experiencing depression during the pandemic. We're not going to do a survey of everyone in the country to see how they're doing, but we might take a sample of people and see what proportion. And if we get a large enough sample, which we'll talk a little bit about, then we can get a pretty good guess as to what's happening across the nation. That's assuming that we take a random sample of folks and they don't select themselves into that study. So we're not going to go a lot into methodology, but it is important conceptually to what we do in this course. Okay, so we're also not going to get into all aspects of analysis or research because biostatistics are really applied primarily for quantitative measurement. And that's the ones that we're going to be most concerned about in clinical settings. So every day you're taking all kinds of measurements throughout your work day in terms of blood pressure, height, weight. You're taking, looking at lab values, you're looking at medication dosages, you're looking at all kinds of different factors, and at a patient level, you are thinking about, well, what combination of characteristics does this person have, and how does that impact what type of treatment they will receive? And you may not necessarily be involved in the decision making, but it's important to know where those, how those decisions are made. And so some good examples would be when you adjust a dosage of a medication based on somebody's body weight. That's a bivariate association, and something we have to consider two different variables: a person's body size, and then the dosage. And obviously, these are based on population averages, right? Someone's actual individual response to a drug is not going to be exactly the same as someone else who has the same BMI. But what we need are rules or decisions to be made based on what we expect to happen based on the population. And so a lot of those kinds of decisions behind the scenes are based on statistical information. So we won't get into qualitative research. I am not a qualitative researcher. Just to give you some idea of what qualitative research is, it might be interviews, it could be ethnography, where you're making observations and recording notes. It could be reading through transcripts, those kinds of things, focus groups, interview type things. So we won't get into that. And there's totally different tools for analyzing that kind of information, even though it's valuable. So as I mentioned earlier, part of the goal here is just to improve our scientific literacy, our ability to understand and appreciate the literature. And when we see the results in a study, we can actually look at table 1 and table 2 and table 3, understand what they mean, see a figure and understand what it means. And that's really empowering to not just trust the words of the researcher, but to also be able to understand and make some decisions for yourself based on the quality of evidence. And so it really will make you better scholars. It'll make you better practitioners because you will be able to assess the quality of evidence yourself. Biostatistics is really part of the language and culture of science and medicine as well. And so just being fluent in some of the terms will help you kind of navigate some of those learning workshops you may attend, or discussions that you may have, or team meetings where there may be some statistical information presented. And it always feels a lot more comfortable to be fully fluent in that language and that culture. And so having that background is also important. So when we talk about a mean or standard deviation or a distribution, that you understand conceptually what those things are, even if you're not doing those things day to day. So like I said, really this is useful even if you have no plans to do research. And not everyone needs to do research, but you may find yourself wanting to do more with your career, and there are opportunities for people in healthcare settings to get involved in research. And it could even be something as simple as a quality improvement project within your own location. So you may want to address some issue systematically and assess whether or not what you did is working. And so you're going to need to apply statistical methods. And so adding a little bit of knowledge about research and statistics will actually improve your marketability in certain settings. And more healthcare institutions are being required to report out statistical information as a matter of accountability. And there's a mandate now to serve the population around you if you're in a hospital setting. And so all the more that we need to collect and understand information. So hopefully I made a decent sell on why we need statistics. If you're not convinced, yeah, I hope we've got 4 weeks, so we're going to work on it. So another area that has really emerged, especially with technology, is the ability to visualize data. And we will talk in this class about visualizing data. We use histograms, pie charts, things you may have already done, just playing around in Excel or doing lab reports or things like that. And some of them are going to be really, really familiar. We're going to also, though, think about these things slightly differently as we move forward in this course. But visualizing data is one of the most important first steps to understand our data, understand what the distributions are and what's happening. And so as a first step, I always recommend making some graphs and charts so you can see what it looks like. So some examples that you may encounter. Here's just a look at the rate of surgical site infections at one location over time. And you don't have to be a statistician to see that there is a lowering systematically, or I should say continuously, between the baseline 2010 and 2017. Now in this case, I don't know if there's an intervention, but you can see that this hospital or this site is doing a lot better with surgical site infections. And these are the proportion of cases. So that doesn't have anything to do with maybe declining caseload, just things like that. It's a percentage. And you can see that at this location, it went from 8% down to 2%. So the next natural question is this trend real? Meaning, is it something that we can understand is based on actual reliable information? How is it measured? And did they use a subset of cases to determine this? Is everyone in the hospital assessed for surgical site infections? And these are going to alter our understandings and our conclusions. And when we learn statistical techniques, we can say, okay, well, this trend is real in terms of not likely being due to chance. And that if there had been, let's say, an intervention that was implemented in 2010, in this case, that likely it's working. Usually we do better study designs where we have a comparison group, but often within certain settings we may not have that. And so we can at least look to see if there's a true kind of monotonic trend of improved surgical infection rates. And I think we can all get around the idea of improving healthcare as being important. Here's another example of just data visualization showing where children in California get their care. So it looks like the mean is a general practitioner, some are with a clinic hospital, some children have the emergency room as their main source of care or urgent care, and then some, or a good portion, have no usual source of care. And so this is a quick way of representing information. You're probably going to see these kind of graphs all the time. You've probably created these kind of graphs all the time. And this is what we call descriptive statistics. We're not doing any inference to a larger population necessarily. We're just describing the characteristics. And we're going to learn some of the tools to create these sorts of graphs, but also to understand the power and the limitations of presenting information in this kind of way. We won't get into this at all, but I love maps. And we really haven't developed statistical tools yet to deal with spatial relationships. There is an emerging area called spatial statistics, but they don't really conform to the statistical properties that we will be teaching in this course, and they really need to develop their own kind of theory, and that will evolve. But maps are cool, and they're also a good way to visualize information. So here we can see patterns of where the hotspots for asthma ED visits among pediatric population. It looks like there's a hotspot in Fresno County. It looks like San Diego County is actually doing relatively well, at least compared to some other parts of California on that one. It may have to do with something with air quality. It may have something to do with how medication is managed. So this is just a first pass look at which you can then maybe develop some hypotheses about why it is that one area would have a higher burden of asthma ED visits versus another part of California. And this is something like maybe a state health department might look at, but it's also something that you might be interested in considering yourself, especially if you've seen an increase in your population of children who are using the emergency room or needing to use the emergency room for asthma. So visualizing data is great, but there's a lot of ways in which information can be distorted by using simply visual tools. And a lot of statistics, when they are presented in visual formats, whether it's in the USA Today newspaper or on the news, sometimes those representations aren't always accurate, or they can be misleading. So when we analyze data, we're applying statistical techniques that really allow us to make decisions about whether something is likely due to chance, or is it likely due to the effects of an intervention, or is it likely to be a true association versus a false association? And so analyzing data using numerical approaches is really where we can kind of decide, okay, is this something to be, is it statistically significant? Does it have clinical significance? And estimates of how big effects are. So we not only get an estimate of effect, but we also can determine how confident we can be around that estimate of effect. So for example, if we were to do a clinical trial on a new drug and we were to compare it to either the existing drug or a placebo, we would want to see that it's at least as good as the drug that is currently at the market. Hopefully it would be better, right? And so when we do a study, let's say of a new drug, the goal would be to establish that not only does it have a higher effect, a beneficial effect, but that we can be confident that if we take this to scale, not just within our study population, but if we were to apply this broadly, where is the true value going to lie? What can we expect for the true difference to be from what's currently done? And that's where statistics come in. Anyone can just count up and measure things and count them up. But this will then allow us to say, hey, is this likely due to chance, this difference? We just happen to have a slight difference in one group that we sampled versus another. Or would we actually expect to see a true difference if we were to implement this as a best practice? Okay, and this gives us a plausible range of effects that we can expect given a specific estimate that we get from our data. And we'll talk more about that as we move through the course. As I mentioned, we're going to do a lot upfront with frequency distributions and describing their characteristics and finding the mean, the median, the mode. But distributions are also important for understanding statistics more broadly, because a lot of our assumptions in statistics are based on how values are distributed. And frequencies are simply counts of specific values. They can also be ranges when we display them graphically. And we often visualize these with a histogram or a pie chart or something like that to first look at them. In this class, we're going to primarily use histograms where we can see the most common values. You can think of that as like a bell-shaped curve or any number of curved graphs that you've seen. And it's often our most useful step in data analysis, descriptive statistics, and also data cleaning. We want to make sure that when we've taken measurements that we don't have outlying values, really extreme values that are just biologically implausible, or negative values, or things that may suggest evidence of just misentry of the data. We will also, as I mentioned, discuss levels of measurement, whether something is continuous. That means that something like temperature, though we report it out in whole degrees, I think we just hit 110 here in Seattle, where I am. There's obviously decimals, and you could go to any number of decimals if you really wanted to in terms of Fahrenheit or scale. So that would be a continuous measure. An ordinal measure would be something more like letter grades. And we don't like to talk about grades yet, do we? But A, B, C, D, E, and F. Though they're associated with a point scheme, the real meaning of an A versus a B versus a C versus, God forbid, a D, or God forbid, a C. The distance between those is not necessarily equal. And that's true of things like educational attainment, but there is an ordering, there is a rank ordering, but the distance between any 2 points is not always the same. And then finally, nominal or categorical. I prefer the term categorical because we talk about categorizing our data. We don't talk about nominalizing our data, but they're really the same thing. Nominal, just the name of something. So sex would be a good example. Religion would be an example. So there's no inherent ranking, and they're just categories or just descriptive characteristics. Eye color, what your favorite TV show is, not necessarily an interesting measure, although I'd love to know what, what you're watching. But there are things that are simply things you name, things that are categorical. And we're going to use all 3 of these types of measurements in our class and learn tools to look at the relationships among those different levels of measurement. We'll look at measures of central tendency, mean, median, mode, which all sound the same because they start with an M, but you'll quickly learn what the differences are. I don't know if it's good or bad that they all start with M. It certainly results in some confusion, but then also you can always think mean, median, mode. Those are the 3 measures of central tendency. The mean is probably the most frequently used and the most important for statistical purposes, followed by the median. The mode, we don't use that often. The mode, if you don't know what the mode is, it is the most commonly occurring value, and this will come up again in the lectures. But those are things we'll cover in this class. So this is just an overview, by the way. You do not need to be taking notes on this. And then we're going to get into, in this course, bivariate analysis. So rather than just describing one piece of information or one observation or one type of observation that we're collecting, we're going to say what is the relationship between 2 variables. And so through this, we're going to use cross tabulations. That would be for categorical data, or it could be for numeric data that we've categorized. T-tests and ANOVA to compare the means of 2 groups, or in the case of ANOVA, the means of multiple groups. And then also correlations, which would be looking at 2 continuous measures and looking at the relationship between those. So when I say we're going to apply the appropriate tool to the level of measurement, this is why we have to learn different approaches, cross tabulations, t-tests, correlations. The reason we have these different approaches is because we have different levels of measurement. If we didn't have different levels of measurement, we wouldn't need so many different types of approaches. Okay. I mentioned comparison of means, t-tests, ANOVA, MANOVA. We're going to get into all of those. And then we're going to wrap up the course with probably the most powerful tool that we're going to learn in this course is correlation and regression, particularly regression. And it looks at the linear relationship between 2 variables. Or in the case of regression, we could use multiple variables. A very powerful tool that is used both in medicine and across science, but then also even in things like business and finance and things like that. A lot of linear models are being used. Not always appropriately, but in the case of economics, linear models are one of the more important tools that are learned. And quite a few people are making a lot of money because they know how to do linear regression. Basically, it allows you to isolate the things that are the most predictive of some outcome. And it's also how we often in medicine can determine the independent effects of different factors on some outcome of interest. And so we're going to get into regression just a little bit, enough to understand it, and hopefully that'll whet your appetite for learning more. We won't cover logistic regression, which is an important methodology, but it's something that you would take more in a graduate level course. We also will not cover survival analysis, which is common in treatment studies, but it's kind of a course in itself, so we won't cover that. As I mentioned, we use regression to predict things, some outcome variable, which we would call our dependent variable, and we collect observations, independent variables that we theorize to be associated with that dependent variable. And we can use linear regression to kind of parse out the effects, the individual effects of different factors on some outcome. Very powerful, but we also have to make sure that we're taking the appropriate steps, that our data is conducive to doing this kind of regression techniques, and that we're interpreting it appropriately and our assumptions are met. But like I said, it's a really powerful tool, and it's so widely used that pretty much any area of research you will see some sort of regression technique being used. Okay, so that's kind of the course content overview in terms of topics. I also want to talk about what you're going to see here online on the Blackboard interface and what's available to you. First, there's me as far as a resource. I will be available both for office hours, and we're going to do some live optional but highly recommended live tutorial sessions once a week. If you can't attend those, I will record them, but I hope that you'll all attend. But anyway, so the course materials syllabus is actually not under the tab that says syllabus on the sidebar in Blackboard. It's in week 1. I'll also send you an email with the syllabus just to make sure that there's no one who missed that one, but it'll also be under week 1. The weekly recorded lectures, these are actually done by Dr. Myers, who is the co-lead on this course with me. I'm relatively new to National, and so he does a great job, I think, covering the material, but I'm here to kind of be that lifeguard when you feel overwhelmed and you're like, I don't even understand something. I will be happy to talk with you either in the live sessions or provide clarification by email. But I think we complement each other pretty well in terms of our approach. So watch those weekly recorded lectures. You don't have to watch them all at once. I know the first one's like an hour and 50 minutes. I don't recommend sitting down for an hour, 50 minutes necessarily, but you can do that if you want. But you can also go back and watch these as often as you need to prepare for your quizzes and exams, which we'll get to in a second. The textbook, I think, is outstanding. I have taught statistics for many years, and this book does a great job of cutting out some of the more theoretical discussions and the more mathematical discussions and really gets to the nitty-gritty. It's also written by a nurse, which I think helps in terms of keeping the examples relevant and also just questions that are of interest. And so I really appreciate her writing style, and I think she does a great job. So I hope you enjoy reading your textbook. I do hope you will read it. It is very much worth the time. I don't always say that about statistics textbooks. Sometimes we just use the appendices and the tables in there, but in this case, I think, especially the first few chapters, I think it's good to really dig in and get your head around some of these concepts. The live Zoom sessions, which I'll talk a little bit more about. There are some review and study aids that are on each week. So I created some flashcards for you for key terms. The default is flashcards. You can alter the settings to do some matching type exercises, but I find that's a good way to learn some of the key terms. Those study terms will be concepts that you will need for your quizzes and your final exams. So those tools are really helpful. And most importantly, perhaps, we also provide you access to 2 statistical tools. One is StatCrunch, which is a web-based statistical software, which is not necessarily the most powerful statistical tool in the universe, but it's available and it's really easy to use. So it should take some of the headache of learning more sophisticated stat software that you don't really need. It's more advanced features for. And it really is capable of doing any level of statistics. It's just, it's a really great one for teaching because it kind of cuts out some of the extraneous stuff that only is used rarely. And then there's the StatLab software for doing calculations and homework, and you'll be directed to use that resource in your homework. And both of these are available on the Blackboard, on the sidebar. And if anybody has any trouble finding those, I'm glad to help find those. I also will be going over this in the live session as well. So wait for that. In terms of course deliverables, you will have 4 weekly assignments, and these will be turned in by Sunday at 11:59 p.m. of each week. And they are to be done independently. However, you are welcome to discuss with peers in the class as you work through the problems, but obviously you need to submit your own work. And you'll do that either using a Word document or a PDF document. It's sometimes easier to cut and paste things into Word and then turn it into a PDF once everything is done. Either way is fine. Word is fine or PDF. There's also a discussion, but it's really homework. But these are based more on using StatCrunch, and also it's more collaborative in nature. So you're welcome to work together and look at each other's answers and things like that. But you do need to post to the discussion homeworks each week. And you can think of that as just an extension of your homework assignments that you're doing in a group setting. Make it a little more interactive. And I will weigh in on those discussion boards as well. So you'll see me in there making comments and trying to clarify as needed. You have weekly quizzes, or at least the first 3 weeks, and then you'll have a final exam in the last week. They're going to be very similar in format, true, false, multiple choice, not a lot of calculations. So, and they are timed. So you have 60 minutes to answer 20 questions, and that has never proven to be too little time. If, God forbid, it is too little time or there's some sort of disaster that happens during the middle, or a small disaster like an unexpected thing at home or something, we can work around that, but it shouldn't be a problem. But do keep that in mind as you're preparing for the quizzes, that they are timed. You will do an independent analysis project. Some people are terrified by the idea of doing independent projects. You do not have to come up with a research project. This is just another small project that you'll do on your own, analyzing using the StatCrunch software. And so I provide all the data. You don't have to come up with a research topic. You don't have to go searching. It's all right there for you. But it's just a more extended kind of multi-step homework assignment, essentially. And that's due at the end of the 4 weeks. And then the final exam will be made available during the final week of class, or the week 4. And you're welcome to take it at any point during week 4. However, the Wednesday Zoom session on that week, I will do a review discussion, and that'll be posted, a recording of that on Thursday. So you might want to plan around that. But you're welcome to take it before then. That is also timed, and that is at 120 minutes to 2 hours. So just keep that in mind. Okay, so those are your course deliverables. My office hours are by appointment within the block of Thursday from 1 to 4 Pacific time, West Coast time. I am available to meet outside that time. I don't want to. No, I'm happy to, especially if there are circumstances where you simply can never meet during that time. I would prefer to meet during that time. But yeah, if your schedule simply does not allow for that, especially if you cannot also attend the live sessions, by all means, I'm more than happy to schedule something at a different time. To do so, just email me at scook2@nu.edu and I will respond within 24 hours with a time slot. Please do give me that amount of heads up so that I can get you penciled in. I'll probably do half-hour blocks. If demand is higher, then I will knock it down to 15, but just so you can know in advance that you'll get a Zoom invite for 30 minutes. Doesn't mean we couldn't possibly go longer if we need to, but unless I have another appointment, of course. Okay, and as I said, other times are available upon request. Finally, with the Zoom tutorial sessions, I know people's schedules just simply may not allow for it. And I don't want you to feel like you're necessarily at any kind of disadvantage or you're missing out if you don't attend. However, it's going to make it a much better experience if you do attend, I think, for everyone. So just the ability to ask questions, I'm going to field questions that come up in chat, or people may be brave enough to speak up, and I will address those questions. We can also pull up our screens, or I can pull up my screen and show you things that may come up. So it is a time for you to learn. I'm not going to introduce new material in these Zoom tutorial sessions. Inevitably, there's going to be some tips and tricks that come up during these sessions. And so I do recommend viewing these online if you aren't able to attend. It's a time to ask questions, interact with your peers, interact with me, deepen your understanding of statistics, and get excited about statistics. I do promise that it actually is a pretty exciting and powerful tool, and even if it's not something that you need for your job directly, it is something you do need. You need somebody to be doing it. And so hopefully you'll appreciate what statistics is all about. I will upload those sessions and have those lives or online some point on Thursday. Sometimes it takes a minute for YouTube to make it live. So that is all I have for this introductory video. I hope it was helpful to get you started. Wednesday's first live session, I know, is right on our heels here, and so I will see you soon, hopefully. And if you can't attend, just you may want to just send me a quick email so I know to look for you or not look for you, but hopefully you are able to attend. But like I said, I'm really excited to teach this course, and I hope that we can meet one way or another, whether it's through the Zoom sessions or office hours. So have a great rest of the holiday week. I hope you had